to the podcast.
Thanks for having me on, Alex. It's exciting to be here. I quite enjoy listening to podcasts. I find myself often listening to them more than listening to music a lot of the time these days, and it's a great way to multitask. And first time on this side of the microphone, so looking forward to it.
It is a good way to consume information, especially for busy families.
Yes, and I've got one of those now, and I live in a house with my wife and two girls, so I'm outnumbered there, and things are always busy. But no, I've got a great wife who does an awful lot.
So today's conversation is going to be talking about COVID and getting back into exercise after COVID, and specifically around preventing long COVID. One of the main treatments they're sort of looking at is around using physiotherapists and exercise physiologists to help with symptoms of long COVID. So before we dive into the nitty-gritty of that, can you just explain to the listeners what an exercise physiologist is, because that's what you are?
Sure. So I guess a lot of people get exercise physiologists a little bit mixed up with physios sometimes, and they do sound a little bit the same, and in fact we do sort of have areas that overlap a little bit. You know, we both often prescribe exercises to patients to help with their rehab and recoveries. Probably the biggest difference is that exercise physiologists tend to work a little bit more with people with chronic conditions, so been persisting for 12 weeks or more, and use an active treatment approach. So whereas our physios can also use an active treatment approach, but particularly for acute injuries.
So yeah, you're more working with actually prescribed exercise for treating chronic illnesses.
Yes.
So I was looking at the causes around long COVID, and obviously they're not really 100% sure. There's a few possible theories that they have. Some of the theories that they're thinking is maybe it's creating like a reservoir that's still got an antigen that's causing some symptoms, possibly causing some type of autoimmune response with inflammation, which is probably where I suppose your team is coming in to help people with inflammation symptoms and stuff like that. Can you explain to us a little bit about what is long COVID and what are some of the signs?
With long COVID, what we're seeing and how we would define it as long COVID is COVID-like symptoms that are persisting for a period of time longer than normal. And I think in our current guidelines is if they persist for more than 2 weeks to go and see a primary care provider, and certainly anything past 4 weeks.
And how long can those symptoms last then for some people with long COVID? Are we talking like some people might go 12 weeks or half a year or? Yeah,
it can vary a lot between individuals, and I'm not sure we really fully understand what to expect there yet, because it is in such the early stages. But in terms of the symptoms there you were asking about, I think there's been a total of about 200 symptoms in total reported. So we're dealing with a very wide range of symptoms here. When you're dealing with that many symptoms, it's very easy to misdiagnose things as well, because obviously that could show up as many other things. So, you know, that sort of process of ruling things out and doing really thorough screening processes is important. That said though, probably the most common one that we see with long COVID would be extreme fatigue, just a sort of lethargy, a tiredness, almost like a chronic fatigue. You know, everything's 10 times harder than it should be.
That in itself is going to be quite tricky, isn't it? Because people are already got chronic fatigue, so then is it chronic fatigue or is it long COVID?
Yeah, exactly.
And we don't know the cause of chronic fatigue.
Exactly, yes. Shortness of breath is another one. It does affect the pulmonary system. Any heart palpitations, chest pain, tightness. We're also seeing problems with memory and concentration. A lot of people talk about episodes of brain fog. And even things like changes to taste and smell. You might go off your favourite food, and it almost reminds me of my wife during her pregnancy, you know.
Yes.
I hope she's not listening, but yeah.
The diet can go into all sorts of strange areas.
It can, yes.
Yeah.
And other than that, I think, sometimes we see joint and muscle pain, and all of those things, you know, as you touched on, can vary in severity levels.
Yeah, some of those obviously sound quite scary, particularly around heart palpitations and breathing issues. So obviously it's very important to do a thorough screening and rule out actual heart conditions like heart failure. And I can imagine if someone is feeling fatigued and having brain fog and low energy, they're not really going to be keen on exercising. And so we will talk a bit about how they're going to get back into movement.
Sure. And I think especially, with regard to exercise, things that we do have to be particularly mindful of is those fatigue elements, both during and after exercise, any dyspnea, so shortness of breath, cough, often it's a dry cough, and of course any chest pain or tightness. And the other thing that I think pops up quite a bit with regard to exercise and long COVID is something called post-exertional malaise. Is that something you've...
No, but explain.
Yeah.
Feeling crappy.
It's basically just something that makes everything worse. It's a worsening of symptoms following even just a very mild bout of physical activity or even a small amount of mental stimulation.
Because obviously normally after doing exercise you often feel really good if it's normal exercise.
Yeah. Often a bit of moderate intensity exercise in the morning. You sort of find in most people their energy levels go up and they feel better the rest of the day. They tend to sleep better and things start to improve in a whole range of fronts. But certainly with post-exertional malaise, you can see a worsening of symptoms, progressively getting worse right through the first day, even the second day sometimes, and then that lasting for days or weeks.
And what is the latest research around preventing long COVID in terms of movement? So if you've had a COVID infection, like how quickly can you get into exercise, and is that potentially going to cause long COVID? Or
I think before I answer that question directly, I think it's probably also important to consider some of the secondary conditions that commonly occur following a COVID infection. There's things such as psychosocial factors, which we've heard are really on the increase.
So dive into that a little bit for
us. So things like depression and anxiety increasing.
Just not being nervous about getting out in public and socialising again.
Well, in fact, I'm not sure we even know whether there is actually a biological change in the brain that occurs with COVID, or whether it is those sociological, environmental aspects. But there's certainly things that are more prevalent to be aware of. Affected sleep, appetite and nutrition. So I think we need to be aware of all of these things as well in order to best manage their recovery from an exercise point of view. So sorry, your question was the latest research around preventing long COVID. That's a tough one because we are still in the very early stages of that. Research is happening at a very rapid pace at the moment, but there is limited evidence for specific exercise, if you like, as a treatment method. And I think we need to take a fairly conservative approach at this stage. I think it's also important to always, stick to the, ethical foundations of medicine, of do no harm. That said, when it comes to prevention strategies, some of the research I've seen really try and break it down a little bit into different groups, and a lot of those groups tend to depend on the stage and the severity of symptoms. For example, if someone hasn't contracted COVID, then exercise promoting a strong immune system.
If you haven't had COVID, you're saying, so keeping your exercise up and staying really fit and healthy to boost your immune system.
Yeah. And this is what we would call prehabilitation.
Okay.
If someone was going in to have a large knee replacement, well, we know that the better condition that they are in before having that done, the faster the recovery. All else being equal, and with a healthy person, our immune systems with regards to exercise start off fairly low if we're very sedentary. It gets better and better as we exercise more, maybe half an hour a day of moderate intensity exercise, and then it starts to fall off that cliff and head downwards after that when we start to get too many things on our plate. Maybe we're training for a marathon, we're running ourselves into the ground, so to speak, and that causes another big fall off.
I was wondering what you would say about people that are maybe training for like Ironman and marathons and things, because it must get to a certain point where that's putting the body's immune system under pressure, and so that group of people obviously would have to have been quite mindful, or would be quite mindful. I'm saying would have had to be, in that we've probably moved through the peak, but it's still very prevalent.
Absolutely, yes.
The other thing that I wanted to talk to you about, with these sorts of things around exercise and COVID, are kids and adults in the same group, or would we say they're sort of separate and their kids don't have as big a risk with a long COVID? Or
I guess it depends really on the stage of that COVID infection the person is in. You know, someone who's recently acquired COVID, or they're in the early phase of recovery. Yeah, those things really need to be guided by the severity of the infection. They might be totally asymptomatic. So knowing what you're sort of dealing with there at the start certainly helps to frame the treatment plan going forward from there. I guess as a more general recommendation, I think strenuous exercise while you're actually affected, that acute phase of COVID infection should generally be avoided. And that kind of goes across that adults and kids demography as well. But yeah, we know that exercising while infected with COVID definitely increases the risk of inflammatory cardiac and pulmonary complications.
Does that include even light exercise, like getting out of the house and going for a walk?
No, I think things like that are quite light are good things to do if you can. Yeah. Because
that means getting out in fresh air,
exactly.
Getting sun exposure,
yeah.
Good for your mind as well and the body.
Yep. And so what I would actually say, and this might sound a little bit strange coming from an exercise physiologist,
is stay at home and rest.
Look, I think not total rest, but to at least prioritise getting back to work and your normal daily activities. Right?
Okay.
Don't try to just resume your life as it was, let's, the clock's ticked over this and let's just, go back to how it was, like in a time machine. It doesn't work that way. Until you can resume your normal activities of daily living and resuming your normal job, and that varies for a lot of people, of course, right? I mean, some people are very sedentary. Some people, might be a brickies labourer and running around with wheelbarrows full of concrete all day, and so they get definitely their fair share of incidental exercise. So there's different physical demands there. I guess I would say, try to get 2 weeks of doing those normal things before you start to look at starting to bring the exercise back in.
Yeah, that's interesting. So with other illnesses, you might, if you've had, tonsillitis, once tonsillitis is gone, really relatively quickly, your energy and stuff will come back and you might be able to resume activity pretty quickly. I suppose this is a different illness and everybody has to listen to their body and go at their own pace.
Yeah, and listening to your body sometimes is a very good guide. In terms of when you are then starting to integrate a little bit of exercise, I recommend starting with short bouts of about 10 minutes of light aerobic exercise, as you touched on there. Walking's a great one, getting outside, some fresh air.
What about swimming? Is that light, or what would you classify in that light group? If a few activities.
So, talking about intensity, what I would classify as light, if we were to rate our level of breathing difficulty, let's say on a scale of 1 to 10. 1 might be sitting on the couch watching TV, so completely rested, unless it's a horror movie or something. So 10 is basically call the ambulance. I'm as out of breath as you can possibly imagine. And so somewhere in the middle, 5 or 6 might be you can still talk to somebody while you're exercising, but you probably couldn't sing a song. So I would start off at about a 3 out of 10.
So you can carry a conversation.
Can carry a conversation fairly easily, depending on the weather coming into winter now, as to whether you might even raise a light sweat or not.
And with children, they obviously, especially younger children, will just go and can run amok and just run and have so much energy in them.
You could bottle it.
Yeah, right. So what about with them? If parents have got kids that have had COVID, I suppose unwell for a few days, bedridden for a little bit possibly, and then they've recovered and they just want to go and run around the backyard and have all that energy. Would you just let them go and do it, or do you want to try and pace your children in the same way that you would pace yourself?
Sure. In a way, those guidelines I spoke about before, about starting off with maybe 10 minutes of pacing at low intensity, monitoring how you feel, your symptoms during and after. Kids, I think, when they're at home in the midst of a lockdown, or they're in the middle of their acute COVID infection, I think it's recommended that they do engage in a little bit of play, a little bit of walking, just light intensity play and activity.
Yeah. Okay.
And I think that's fine.
Yeah.
A lot of kids play sport, right? So, and they're all pretty keen to get back to that, and that's good because you don't want to let the team down and things like that. And I wouldn't encourage them to get back into that until all the symptoms have completely cleared.
With children, then, once all of their symptoms have gone, they can pretty much resume their usual weekend sports as they want to. With adults, then we seem to not be as fit as our kids. We might start off on that 10 minutes of slow activity. After that 10 minutes, what would we build to?
I think starting with 10 minutes and getting yourself or walking at a pace that gets your breathing difficulty up to about a 3 out of 10. And so I think gradually increasing, maybe every couple of days, either the amount of time that you're physically active for or the intensity, but probably not both at the same time.
So you might go for a 10-minute walk and just try to build up to a 30-minute walk. And once you've achieved that, then you might try to go for a 30-minute jog.
Yeah, and maybe partial steps along the way to that, but they would be good sort of end goals, I think, over a period of a few weeks. And just monitoring it along the way.
And do you know, does your prior fitness level impact your chances of getting long COVID? If they were really fit prior to getting COVID, are they less likely to get long COVID? That's
an interesting question, and in most cases, you would say having a good fitness base would help you in a way. It's kind of that prehabilitation, right? You're sort of in a better, healthier state to then recover quickly. Very early stages, and there's certainly some mixed reports coming through with regard to this, and some a little bit contradictory, so it's hard to really put down anything concrete on that at this stage. Although some studies suggest an increased risk, particularly of myocardial involvement in moderate to severe symptomatic athletes. So these are very sporty, active people who've had COVID and they've had moderate to severe symptoms and then sort of gone on to develop, some of these long COVID symptoms.
That's really interesting.
So it is, yeah.
So whether that is coming because of what we said before with their immune system maybe not being as strong because their body's constantly under stress, doing those amounts of exercise is a form of stress on the body, or whether it's because they're also probably pretty keen to get back to exercise, so maybe they're also returning to exercise.
It might be. They might have a marathon coming up they're training for, and so there's really high volume, a lot of stress on the body there. Even, mental stress seems to have a little bit of a link there as well.
And so we've spoken a lot about then cardio exercise. What about more, if you like, your weightlifting and muscle or resistance type exercises?
What we find is that some individuals tend to have a better tolerance to exercising in certain positions versus others, right? So somebody might have an exacerbation of symptoms walking or jogging, then sometimes getting them in a face down or in the back or even sitting, exercise in those positions can be much better tolerated. So things like swimming, maybe a recumbent bike, maybe even some weight machines or weights from a seated position to doing some strength stuff. But those things are worth a try. Patients who have been impacted more severely, who are requiring prolonged bed rest, in those instances, that sort of non-weight bearing can lead to a deterioration in muscle mass and strength very quickly, and also bone density. And so where possible there, if you can, there's a few very simple sort of functional and compound strength exercises you can do.
It's interesting how quickly your muscles can fatigue after being unwell and being in bed rest. So if somebody does have long COVID and they're wanting to work with an exercise physiologist to get back into exercise, what's that process look like?
Sure. So that would initially involve going through a thorough screening process, as we said earlier, and that's mostly to determine the patient's history, the severity of the infection, any sort of relevant medical and physical activity, and often that can mean a multidisciplinary approach. I'm quite fortunate to work with a bunch of allied health colleagues. We're all in the same building.
And while we're on that point, you do work at Busselton Physiotherapy Centre. Who are the other allied health professionals in your centre?
Yeah, look, we've got a couple of physios there, a women's health physio, we have massage therapy, a couple of dietitians there.
Yeah, it definitely sounds like so far with everything that we've spoken about, anybody who might be suspecting that they've got long COVID or they are going through long COVID, it most likely need to have an approach from all different angles, looking at the body as a whole. It might be working through nutritional diets, what you're eating, but also nutritional deficiencies, so potentially supplements that might help with inflammation, or even magnesium to help with muscle tensions and aches and pains and that sort of thing. Working with an exercise physiologist to build muscle strength and get them onto a program. So I think that is the part that people could really benefit from, because it's hard to motivate yourself to move and when you're feeling unwell. So I suppose having someone like you do set a program for them.
Yeah, and particularly when they're a little bit unsure, and just like that comfort of having, someone well trained there watching them and supervising what they're doing. We would monitor their blood pressure, we would look at their oxygen saturation levels too, making sure they're not falling low. That can happen without you even realising. And as well, just looking at and observing how that person seems to be responding to a particular level of exercise. Does their heart rate kind of measure up to how heavily they're breathing, or is there something a little bit not right about that ratio there? So we try to be very thorough and try to identify any red flags there, and that helps give a bit of peace of mind. And then we sort of create a plan going forward and try to promote a little bit of patient independence so that they can manage it themselves. And
do you have any other suggestions, any other practical things that people can do? Obviously, if you're a parent and you want to, you've got to look after kids, you want to be back in shape as quick as possible.
Yeah.
Is there any other practical things that you can suggest?
Yeah, look, it's a juggling act, isn't it? And we're all so busy, and we've got a lot of balls in the air, and it's just a case of trying to do the best we can. And I guess there's a lot of misinformation out there as well, and hopefully things like this sort of help to put people on the right track. I think the most important thing, if there was a take-home message from today, is there are a lot of unknowns about the long-term effects of long COVID. And so I think if we take a holistic view of it, there are certain principles that we know are safe if we stick to them. I'm talking about, lifestyle changes. Maybe going through all of those, seeing if there's something that, you can improve on a little bit. Maybe starting with diet. Is there anything that you might be a little bit deficient in that could be contributing? For all we know, that COVID may be taking advantage of, and whatever that deficit may be. Exercise, which we talked about a lot today. Drinking lots of water, not getting dehydrated. As you said before, going for a walk, getting outside, some sunshine, and a bit of socialisation, especially for those people who have been, locked up a lot and haven't had that social interaction. I think, trying to avoid some of the things that are bad for us, having some temperance there with, whether it's alcohol or binge eating on the couch with a bucket of ice cream, and, some of those things that you regret later on. And, going outside, getting some fresh air, or at least exercising in an area that has good clean air circulation, I think is really important. And probably one of the last ones is, I think that probably needs to be talked about more, is rest. Do you have good sleep hygiene? Are you maintaining a good sort of circadian rhythm? We do need a lot of rest in order to function properly and physically and emotionally. And I think with our very busy lives and with COVID and a lot of working from home and people bringing things home, and our days seem to drag out longer sometimes, don't they, than what perhaps they used to. And you know what it's like, you back in the day when you could go for a holiday, you come back feeling quite refreshed, because you've been able to switch off to all of those mental and emotional and physical stresses and leave it behind and feel quite rejuvenated. So I think that's a really important thing, and making time for that as well.
Just those general health principles should help with improving your immune system. So if we can start with doing the basics.
Start with doing the basics.
Before you go into all the crazy other stuff.
Exactly.
Like there's lots of things that you can do, but why start with a really extreme thing when you can't even get the basics done?
You've got to lay the foundation first, I think, and then you can go off into those more specific things.
Yeah. And so if anybody wants to find you or the practice that you're at, how can they get in touch?
Sure, yeah. So the practice I work out of is Busselton Physiotherapy. You might recognise it if you're going down Bustle Highway. It's 55 Bustle Highway. It's now got a blue tree out the front of it.
Of course, yes, you can't miss the blue tree.
Yeah, especially at night, it's got a light under it, so you don't miss it at night time.
And the blue tree is there for mental health, right?
Mental health, yeah. And you know, touching on that mental health side of things, I think at the appropriate time, you know, people should look to get engaged in social physical activities, whether it is sport, whether it's you know, joining a park run.
Yeah, the park run in Busselton
everywhere,
is fabulous. But yeah, you can get them. Yeah,
and everywhere. You don't have to run. You can go at your own pace.
Go for a walk. Yeah.
Yeah. Chat to other people, I think is a really good thing. There's a man walk group who go out at about 6:30 in the morning on Monday. I went this week myself. It was great. They're a great bunch of guys.
I have seen them, and it's growing bigger and bigger and bigger.
Yeah, it's great. It's great. And often we have someone come along and talk about something related to men's health, which is really informative. And you can get a free coffee there as well while you're there and have a chat. So sometimes us blokes just need an excuse to get out and do something before we have a coffee, don't we? So.
Only a few episodes back we had spoken about looking after men's mental health even after having a baby and having kids, and a postnatal period, I suppose, for men. So having a group for all ages, I've seen there's all ages of men that go to that men's walk.
Before I had my first baby, I had this great idea of taking my golf trolley and my pram into the shed, getting in there with the grinder and the welder and coming out with some sort of hybrid so that I could take the baby for a walk and play around a golf at the same time. I thought, this is brilliant. It didn't eventuate, and then, you know, the baby came and reality set in a little bit more, and sort of didn't realise how often the sleeping and the waking and how unpredictable all of that is, of course. So
and would they even go in the pram? Often they don't want to go in the pram. You probably have better luck popping them on your back on a carrier and playing around a golf.
Yeah, I just have to slow the swing down.
I was going to say.
Fling it off, or I'll never get to do that again. So.
So there goes that. And so you're on the highway. What about you've got a social media, Busselton Physio have a Facebook page?
We do, yes. Look, probably the easiest way to come in and see us is just to give one of our friendly staff a call.
Yeah.
The number there is 9752 4174.
Fantastic. We'll put links to their website, Facebook page, all the contact details on our show notes so that people can easily get in touch with you. Yeah. Thank you so much for taking the time to chat with us today about this big new area, which I actually think is going to be quite a big area, and you're going to see a lot of people, we're going to see a lot more people in the health system talking about these sorts of things, whether it be the chronic fatigue or whether it's the long COVID, but it's interesting to see where this is going to go.
Yeah, and I think the incidences of long COVID are probably higher than initially estimated, so I think it will be something that continues to get more and more research, and we'll start to hear more and more about it. So.
Thank you very much.
Well, thank you very much for having me on. I loved it.